Welcome to RhAPPcast, the official podcast of the Rheumatology Advanced Practice Providers, where we delve into the evolving landscape of rheumatology, share insights, and discuss the latest in clinical practice and research. I'm your host, Amanda Mixon, president of RhAPP, and today we are continuing our enlightening series on the pivotal role of IL-23 in rheumatic disease. In this episode, we are going to unpack the real-world implications of Guselkumab therapy. We're diving deep into what makes this treatment stand out, specifically focusing on its relative persistency and effectiveness. Joining us is a very special guest and dear friend, Kyle George, a board member of RhAPP. Kyle brings a wealth of knowledge and firsthand experience utilizing IL-23 inhibitors. And today he's here to share his insights, delve into the science behind IL-23 inhibition, and also discuss what this means for practitioners and patients alike. So Kyle, let's go ahead and start by please giving us and our listeners a quick introduction.
Sure. Well, thank you, Amanda, for having me on RhAPPcast today. So my name is Kyle George, and I am a physician assistant practicing in Idaho. I graduated from the PA program at Oregon Health and Science University in 2008 and got a job doing full spectrum family medicine at a federally qualified health center. I stayed there a little over 7.5 years and then took a job in rheumatology. Where I feel like I've kind of found my home and my specialty. I don't feel like there's any drive for me to search elsewhere. I really enjoy rheumatology. I'm currently transitioning out of a private practice setting into the rheumatology group associated with one of the larger hospital systems in our area, St. Luke's. I was part of the original faculty and steering committee for RhAPP in 2019 and have been an active board member since 2021. So
I was trying to remember when we actually met, and I think I came out there to do something and you came, and I thought, I really like Kyle. I think he's just going to be instrumental. And then of course I start roping you into things, and it's just been absolutely incredible. And it's been so amazing just watching you and just kind of grow from a professional standpoint. Obviously from a clinical standpoint, that's there. And, I'm so excited to talk to you today about IL-23s, but it's just so amazing to see how much you've grown and in the profession and also with RhAPP. So we're really lucky to have you. So thank you. I'd like to just say that officially while we're talking on RhAPPcast today.
I'd like to do the same. I appreciate all the opportunity that RhAPP has provided and all of the guidance and, being able to have you on speed dial and say, hey, Amanda, what do I do in a patient like this? I'm, been practicing for a while, but still I feel like I'm a bit of a baby in the rheumatology field. As we know, APPs were a growing presence in rheumatology, but there's still lots of room for us to grow. So
absolutely. And it kind of feels like it's this huge evolution. And I know in my 17 years, I've seen such growth and in such a positive way. So particularly for APPs that are out there doing it, diagnosing, ordering the appropriate studies, making the diagnosis, and then starting therapy. So I can't think of a better person to be talking to us today. And really, this episode is packed with really good, valuable information that shines a light on managing rheumatic diseases. So with that, let's go ahead and get started and explore the relative persistency and effectiveness of Guselkumab in the real world right here on RhAPPcast. So let's go ahead and get started. I've got some questions for you, Kyle.
Sure.
We're obviously, as I mentioned, we're going to be focusing on persistency and efficacy. So can you start us out with, do you have any literature for our listeners pertaining to this area?
Yeah, so like many of the medications that we use in rheumatology, Guselkumab got its origins in psoriasis, right? So it was approved for the management of psoriasis in 2017. Some of the trials that were used to be approved then were the VOYAGE 1 and 2 trials, as well as Navigate and ECLIPSE trials. And all of those showed, Tremfya or Guselkumab to be safe and effective in managing patients with psoriasis, as well as showed some improvement in regards to patients' quality of life. They demonstrated superiority over one of the leading TNF inhibitors in the market at the time, as well as one of the IL-17 inhibitors at the time. Obviously, in rheumatology, we care about skin, but there's so much more that we're dealing with, and so it's nice to kind of know where we came from with the medication, and then also where we get our indication. So Guselkumab was approved for psoriatic arthritis in 2020, following results from the Discover 1 and 2 trials, and this investigated the efficacy and safety in treating adults with active psoriatic arthritis who were either biologic naive or had previously received treatment with TNF inhibitors. These trials provided evidence to support the use of guselkumab in the treatment of patients with active psoriatic arthritis, and post hoc analyses have been conducted which have shown that it also is able to provide reduction in radiographic progression of structural joint damage, resolution of dactylitis and enthesitis in our patients, as well as improvement in axial symptoms for patients with psoriatic arthritis. So, axial symptoms included reduction in sacroiliitis, as well as improvement of spinal mobility. They did use, BASDAI and ASDAS, some of the familiar scoring systems, that we use here that are used in evaluating efficacy of these medications in clinical trials. So, it's nice because sometimes we know that we have to tailor our treatment to patients, and, we can't have a medication that is only going to manage their psoriasis, but it's not going to do anything for their joints, or it's going to do, it's going to help their joints, but their back's going to, still be causing them to lose sleep at night and not be comfortable throughout the day. So, having a medication that has some comprehensive coverage for all of the symptoms that we see with our psoriatic patients, I think is important. Yeah.
Absolutely. I mean, I couldn't agree more. I think that's such good data, and it's really good to know that, and it helps us as we're kind of making decisions for our patients. So what you said, was the Discover trials, both the biologic naive patients and axial psoriatic arthritis patients showed really impressive results. Those, along with the post hoc analysis of patients with psoriatic arthritis, really do demonstrate the value of IL-23 inhibition in those patient populations. So now that you've started us out with some really great clinical trial data, let's talk about real world data, so that our listeners really can gain some insight, understanding what that means. And really what that means for their patients in the real world outside of a clinical trial, because obviously in a clinical trial, everything is very standardized, as it should be. But what about the real world?
Right. Yeah. So things that you see with, real world, treating patients, patients that stop taking their medications, or, patients that, aren't benefiting from them, or for one reason or another. I think that we, are able to extrapolate data and pull from, things like this, the CorEvitas psoriatic arthritis and spondyloarthritis registry. There was data from them that evaluated 6 months persistence and effectiveness, showed nearly 80% of patients persisted with guselkumab over 6 months, achieving significant improvements in their PSA disease activity. This included joint and skin symptoms, as well as patient-reported pain, which is always important. There was also data presented at CCR West that showed 12-month persistence on guselkumab versus TNF inhibitors. So, at that 12-month mark, there were 72% of patients that had remained on guselkumab, compared to 44% of the patients who had been on TNF inhibitors. So I think that, the data matches up. So we saw that in the Discover 1 and 2 trials, we had up to 100 weeks of effectiveness and persistence with the use of guselkumab, and we're seeing that in real world data.
And I think that that's really, what's important. I love that we have that information that we can rely on to really talk to our patients. It's great to have the clinical evidence, of course, and the clinical trials, etc. But knowing that there's also a reasonable amount of real world evidence, I don't know, that helps me when I'm, making decisions for which, potential medication I'm going to use. And, I think that many patients staying in the trial speaks to the tolerability of the drug. I think most of
Right.
us would agree. So I want to hear kind of some personal stuff from you. I mean, do you have any case studies or real world, for yourself in clinic where you've utilized IL-23 inhibition in your patients and how that helped their quality of life and disease management?
Sure. Yeah. I think that, admittedly, I think that the practice where I was at, we were a little bit slower up on the intake, so to speak, with using IL-23 inhibitors, but we do have a number of patients that we've started on them. I had one patient with a long-standing psoriatic disease, had been on multiple different medications, like we see with all of our psoriatic arthritis patients. And it just so happened that she was found to have a very early breast cancer. Went off of her medications, went through the appropriate treatment recommendations as outlined by her oncologist, and then she had a little bit of she experienced flaring while being off of her medications, but also had some reservations about going back onto some of her medications. And we kind of started looking at the various options. She liked that Guselkumab, had a very favorable safety profile. So that's another thing to remember is we've got safety data from the psoriasis trials as well as the psoriatic arthritis trials, and it is a very, very safe medication, and particularly in regards to malignancy risk, which, was her primary concern. And, my last contact with her, she was doing quite well on her new regimen. I know a lot of her symptoms, she had axial symptoms. She had a lot of kind of enthesitis type symptoms like with plantar fasciitis, and Guselkumab had been working really well in managing her symptoms.
Yeah, I completely agree. I feel like oftentimes I mean, it's interesting because when you have these conversations with patients, right? Like you diagnose them, you make a diagnosis of psoriatic arthritis. I get a lot of referrals from dermatology and, I make it this diagnosis and then we're talking about these therapies and sometimes that can be really scary, particularly when you have to say, okay, and you can't have history of da, 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 da,
Right.
all these different things. And it's really nice to have an option for people that I really can say the only contraindication is if you've had an issue with it previously.
Right.
And I love that to say. And I don't have to, of course, we still talk about the infection risk, of course, and not this drug is not for everyone. But my experience with guselkumab is just that too. I think people tolerate it. I think, they stay on it. And again, I think that speaks to how the longevity of it and kind of the strength of it over time. And, I tend to see patients, from a skin standpoint, get that happens pretty fast. I do find that for the joints, it takes a little bit of time. And so I try to give patients realistic expectations. But again, they love that the safety of this. And, you know, I have some people that respond right away, but then others it takes a little bit of time. But again, because it's so well tolerated in my practice, patients want to stay on it and they do well with it. And I've had similar success stories of patients with rip roaring arthritis and skin disease that just seems to melt away with this medication. And so I'm a huge supporter of it too. I think it's
Right.
great.
Another thing that I think helps with patients being able to stay on the medication is the frequency, right? You go from having to inject, certain TNF inhibitors, once a week or once every 2 weeks to, having your, after your initial loading dose of, 0 weeks, 4 weeks. And then after that, it's just once every 2 months. And that's easy, right? So I
Yeah.
think patients, they're much more likely to stay on a medication, especially if they've got just a little bit of that needle phobia, if they're only having to inject every 2 months.
That's so true. And, I think that's more of that real world stuff, right? Like you always assume that your patients are going to do everything that you ask of them.
Right.
I know I do, but I think in theory, that doesn't happen, right? And so one thing that I've heard from patients is just that, like, I actually really like that I only have to do this every 2 months because I'm going to be honest with you, Amanda, I really wasn't taking my other medicine weekly, because I had to travel and I didn't want to take it with me and this or that reason, so much so that you even wonder like, oh my gosh, how much were you actually really taking it? So that also I think aids to another benefit. And really what I'm finding out in the real world is that, people really aren't doing everything that I asked them to, but it seems like this one is easier to follow because again, it's only, every 8 weeks after that initial loading dose.
Right. And I kind of use that to set their expectations a little bit as well. Hey, you may see some real benefit right up front with the skin, because we know it works really, really well. But, sometimes I say, well, you're only taking the shot every 2 months. We're going to have to give it a couple of injections, like, just like with most of the, biologics, I'll tell patients, give it 1 to 3 months to kick in, up to 6 months for full benefit. And the data shows that, that's kind of where things do start to level off. It's right around those 6 months. But the great thing is that benefit persists, right? We have data, going out, that 100-week mark where things are still, going really, really well from that 6-month mark on. So.
Absolutely. And I think that's important, especially for our listeners, to really set those realistic expectations with your patients because, you don't want to give them, a false sense of hope. But of course, I mean, you want them to have hope, of course, but you want them to be realistic about it. And, I do think that it's so interesting because I almost every podcast I tend to like age myself and say things like I've been doing this for 17 years and whatever. But because we have so many options, I think sometimes and this is happening, maybe we switch a little too fast. We a patient comes in after 2 months and says I don't think this is doing anything. And I think we really do have to set the tone of, to your point, you got to give this, after that, initial dose, you really do have to give this a couple of shots to determine if this is going to be starting to work for you. But having that idea of like, yeah, wait till 6 months, like, let's see how you do with this, I think is really important. So on kind of that same of our listeners and how we can help advise our APPs in rheumatology, do you have any recommendations for APPs in rheum that are utilizing IL-23 inhibitor therapy to help them optimize outcomes? I mean, we kind of already alluded to it a little bit, setting those realistic expectations. But anything else that you can think of to add?
Yeah, I would say, don't be afraid to use it. One, right? Like I said, we were a little bit slower on the um, on hopping on the IL-23 bandwagon at our clinic. I'm glad that we finally did, because I think that there are patients that are definitely benefiting. It's a safe medication. Patients stay on the medication. So don't be afraid to use it, and think about in those patients that have certain certain features, like I said, the near complete resolution of dactylitis and enthesitis. Those can be some of those nagging problems for patients where they're just like miserable. They've got plantar fasciitis or like enthesitis of the the Achilles insertion, and they've been dealing with it for years. And then also I'll kind of set that expectation. Well, hey, look, this has been going on for years, and it may take time for that medicine to really calm down all of that, inflammation that's been going on over time. So, I would say, yeah, don't be afraid to use it. Think about, using it in the right patients, yeah, I think that'd be my advice.
Well, I think that's wonderful advice. It's very pertinent, and don't be afraid to use it. Look at the safety profile,
Right.
look at the tolerability, and of course, ultimately the efficacy, because it's great that people tolerate, but you also want to know that it works for people. And we have evidence, both clinical trial wise and real world, that I think show all of that. So, thank you so much, Kyle, for all of your input. I think that this has been instrumental for our APP listeners. and everyone else that might be listening that just wants to learn something about IL-23 inhibition. I think it's definitely one of the ways of the future for us, and it just makes it really exciting to be practicing in rheumatology. So, with that, I think that's a good wrap up for us. So thanks so much, everybody, for listening to RhAPPcast, which hopefully is your go-to podcast for all things rheumatology advanced practice providers. We would like to extend a heartfelt thank you to Kyle for joining us today and sharing his insights on Guselkumab and its impact in the real world. Kyle's expertise has undoubtedly shed light on the significant role of IL-23 inhibition in treating rheumatic diseases, and of course, the promising future it holds for patients and practitioners alike.
Yeah, well, thank you so much for having me, Amanda. And it's been great to continue to watch RhAPP grow over time, and now watching RhAPPcast grow and being able to be a part of it. It's been great. So thank you.
Yeah, never in my wildest dreams did I think that this would turn into me being a podcast host, I have to say, but I'm really enjoying it, and I get to talk to such amazing people just like you. So, and for our listeners, I hope that this discussion on the relative persistency and efficacy of Guselkumab in the real world has enriched your understanding and sparked your interest. Please remember that this is part of our series that's focusing on the role of IL-23 in rheumatic disease, aiming to equip you with the latest knowledge and insights to enhance your practice and patient care. So please listen to all the episodes. Really, they all carry different aspects of this, and all are really important in understanding this molecule to the highest level possible. We're excited to continue this journey with you, exploring the frontiers of rheumatology and how they involve APPs. Please be sure to subscribe to RhAPPcast on your favorite podcast platform and stay updated to the latest episodes. And of course, don't forget to explore the growing RhAPP ecosystem further. We are on all social media, so of course you can go to rhapp.org. You can connect with us on Twitter at RheumAPP and Instagram at RheumAPP for the latest updates, insights, content, and exciting announcements. And again, I'm Amanda Mixon. Thanks so much for tuning in and being part of our RhAPP community. We could not do it without you. So until next time, friends, we'll see you soon.